Hello, I'm Regina McCann-Hess, President of Forge Wealth Management, and we are here today for our Thriving in Health and Wealth series. I want to welcome one of my co-hosts, Meg McGinn of Osprey Health, to our show today. And Meg, can you give us like a little bit of background about you again and tell us what you're doing and introduce our topic for today?
Great, Regina. Thank you so much for letting me be here today. I'm looking forward to discussing the healthcare industry, the market right now, and how it's affecting individuals. Obviously, we're in the middle of a pandemic, which is just wreaking havoc in so many ways. But healthcare is of the utmost importance with conversations when we talk to our clients, our friends, our family members. So first of all, I hope everyone out in your audience is staying safe and healthy. And, let's hope for a very smooth transition into the fall season with regards to COVID and perhaps even a vaccine in our near future. Yeah. As far as Osprey Health goes, Osprey Health is an insurance agency in Berwyn, Pennsylvania. We are a women-owned agency. And I emphasize that because what differentiates us from so many other brokerage agencies in our area is we really try to put the health and wellness of the individual, the client, the group, whomever we're working with at the highest level of priority for us. So our philosophy is if we can help keep you and your employees healthy, then we are going to help keep those insurance premiums as low as possible, keeping everything as efficient as we can in a working environment.
Thanks for bringing that to the table, especially as a woman-owned business. I wonder if you think differently because you are a women-owned business and you're thinking about the whole health picture as opposed to just one piece of the picture, and that feels like the feminine side, but it brings, you have to heal the whole self. So I'm so glad that you think that way.
Yeah, I know that's how you feel. We've talked about this many times off camera. And, I think as women, we just ask different questions. Mm-hmm. And there are times when you have a conversation with somebody in the office as you're waiting to go into a meeting and you hear that they're juggling caregiving their parents as well as their children, as well as working a full-time job. And you can just see the exhaustion on their face. And that changes the conversation when I actually go in and speak to an employer, for instance, because knowing that there is a very high level of stress in the workplace is going to just play into all kinds of health issues overall. So we, because of that, because I saw it so often in the 20 years I've been in this industry, I actually formed with a partner of mine, Patty Burke, last year, a wellness company called Whole Health Co. And it is a corporate wellness program because we felt it was important to integrate the wellness with the conversation of health insurance. And so what we do is we embed a wellness program where we assess the health of the community, whether it's individuals, whether it's seniors, whether it's in a workplace environment, and then we customize these plans according to what we find.
That's amazing. That's amazing. Yeah. Until I've met you and have gotten to know you, I don't know any other company who does that, who thinks that way. I think it's just amazing.
Yeah, and we were joking one time, and I say joking, it's not joking, but I think you and I come from a previous era where if I said to you, we create meditation rooms now, and employers are encouraging their employees to stop for 15 minutes every day and go sit and breathe and calm and refresh. 25 years ago, we would have been like, "Are you kidding me? I gotta work.
I got a deadline to meet."
Forget that. So, but that is, first of all, it is proven to be so impactful, in every workplace possible, but the employers are now subscribing to it and they want this. They want this for their employees. And I think what I see, which is the most exciting element too, is that this adds that an additional layer of loyalty when an employee sees how much an employer cares about them. When you have your boss say, you know what, you need to stop and take your 15 minutes,
Yeah.
shut it down and go be quiet and breathe and come on back and we'll deal with this when you get back. That really sends, resounds within an employee who is really struggling with a lot of things. So that's Osprey Health. That's what we do. We really look at the entire picture. We focus on anybody dealing with healthcare issues. So we work with employers to evaluate their overall benefits portfolio, and every employer has a different goal in mind. But then we also we work with seniors who are new to Medicare, or who have been in Medicare for a long time, but are noticing a lot of changes going on, and they need to evaluate, am I in the right plan?
Mm-hmm.
And then lastly, we work with individuals. You know, there are a lot of entrepreneurs out there that are self-employed. The freelancing industry has taken off, and they need individual health insurance. 10 years ago, there wasn't much of an option. Now, individuals have more options than ever before, and I actually foresee that market even changing for the better in the years to come.
Good, good. I'm glad to hear that.
Yeah, I'm sure you see it with the financial conversations you're having too, that things have to change. You know, they can't stay the way they are. And this environment that we're in right now, you know, we really don't know how we're going to have to adapt 18 months from now. And so you and I, we're on the ready, right? We're here to help.
Yeah. So today, I think, is a very timely topic as we go into that time of year. But I believe we were going to talk about Medicare, right? And how the environment's going to change for that in 2021.
Yes. So the open enrollment period for Medicare starts in October. It runs through the first week in December. That is the annual open enrollment period every year. You know, traditionally what we found is that people enroll in Medicare and they've been happy with what they have and they rarely change it. And I think that's probably the biggest area that we're going to see shift over the next 2 to 5 years.
Okay.
Is that more newly enrolled Medicare recipients, so those turning 65 primarily, are much more educated to manage care. You know, this has been their world now, whether they've been, you know, in a group plan or just to have their own individual plan. Managed care has been around for a long time now. So they're very familiar with in and out of network benefits. They're not so afraid of hearing the word HMO like they used to be. So we have a much different clientele who's now moving into the over 65 market. And I think that's going to shift what CMS is going to offer and how they're going to offer it. You know, if anybody is familiar with Medicare, they know that you have your Medicare A, which handles the hospital bills. I'm generalizing here. You have Medicare B that handles the doctor bills. You have Part D that handles your prescription. And then you have your Part C, which is your supplemental. That's your gap coverage. And we're seeing those coverages, you know, every couple years, another letter or plan retires.
Yeah.
And so we also are learning that CMS is actually incenting the private carriers out there to create much richer Medicare Advantage alternatives for these individuals to choose, because the Medicare supplemental plans, they're going to be unsustainable. It is expensive, and it's going to turn it to be more costly for the individual as they get older. So, you know, when you lay out your options and you talk about what individuals have to evaluate, those options are becoming more and more and more, which I think is very exciting. Depending on the region of your country, you are going to be you're going to have more options than others. And that has to do a lot with what the insurance carriers and the networks look like in your areas. For example, in the southeastern Pennsylvania area, we have the 5 counties: the Philadelphia County, Montgomery County, Bucks County, Delaware County, Chester County. The networks for private insurance carriers are incredibly strong, primarily due to the health systems and the tertiary facilities we have in Philadelphia.
Yeah,
like
we're very, very lucky to be where we are and be surrounded by so many amazing hospitals and healthcare systems. And, for some of the Medicare plans that I've looked at, they're pretty strong, being able to, affiliate with a lot of those hospitals.
You're exactly right. And so when I say, used to be, people would get nervous when they heard HMO, oh my gosh, I can only use these doctors.
Yeah.
Well, if you're in the 5 county area around southeastern Pennsylvania, and you have a choice between a PPO plan that's more expensive than an HMO, and you start evaluating your doctors and the hospitals you want to go to and the pharmacies you want to go to, and you go online, or you have someone like my team that sits down and we assess that. Who do you want to go see? How do you want to access care? And if you can do that all within an HMO, then the HMO is going to work for you.
Yeah.
So there's no need to be afraid of an HMO, because the way in which you access care is not going to change. Right. What will change is how much of an out-of-pocket expense you have to incur. So those are the conversations we're having more now than ever before. Let's talk about you. Let's talk about your access to care. What's important to you? And I always like to say, give me your worst case scenario. That you fall down the stairs and you break every bone in your body and you're going to need multiple surgeries. How do you want that care to happen? And that's the conversation and how we started. And then from there, we chisel through and identify some plans. So in southeastern Pennsylvania, as the example I'm using, you've got a lot of options. If you want to use something alternative to a Medicare supplemental plan. We're also seeing with 2021, the plan options that a Medicare Advantage is offering versus a Medicare supplement are all encompassing. They are now your hospital, your physician, your prescription drug, your hearing, your dental, your vision, your gym membership, your nutritional one-on-one consultations.
Yeah.
You're helping a certified nurse helping you manage chronic diseases that you might have and navigate that through your carrier.
Yeah. That's amazing. That's great service that they're providing there, and to be able to do it encompassing, actually, I think a lot of times is easier on the patient or the person to navigate the healthcare system rather than having to worry about, oh, well, which insurance am I using?
That's right. And what the other thing I will say that I find as someone in this industry, that's one of the things that's been most frustrating when talking about managed care is in the past, the physician community wasn't necessarily as supportive. You had to get a referral. You had to get a pre-authorization. Well, many times people would go in and the physician's office would say, I don't know how to do it. You take care of it. Well, that's another area that's changed significantly. These physicians' offices are well-versed, well-trained on what they need to do. And in many cases, specifically regarding the seniors, they make it very easy to navigate care. So if you, unfortunately, are diagnosed with something that you don't know anything about, in my personal experience with my clients, they never have to make a phone call. Who do I call? I need a referral. I need a pre-auth. All of that is done behind the scenes. So the end user, that member, gets to go and just make the appointment and show up. And all that insurance stuff is covered for them, as long as, because these physicians' offices understand their role. They have to stay within the network. Yeah. So we have clients, and I love getting these phone calls, that had to undergo a very serious surgery,
Mhm.
And they'll call and say, Meg, I just had to pay a copay. I can't believe that's all I had to pay for my surgery. And that's the system working with all of us, which is terrific, which I'm most excited about. And it's even going to be better for 2021.
Yeah, it's so great to hear that. It is so great to hear that. And for the past couple of years, it feels, I agree with you, it feels like the Medicare insurance is improving each year, and their services are improving each year. Like you mentioned, like the silver sneakers, the healthcare type, workout type things. Some of them offer, like if you have a service, if you have to be in the hospital for a couple of days, they offer a service for when you're home for your first couple days. They'll drop meals off. Even some of the insurance companies do that for you. It's
Yeah, in fact, I have a few clients that called me and they said, you should see the amount of food that was just delivered. And one individual, it happened right at the lockdown in Pennsylvania. And where nobody could go out. And those poor seniors, I had my own children delivering, grocery shopping and delivering food to my parents. And one of my clients called and she had just gotten out of the hospital. And she was blown away that she got this gigantic box of food. And she said, and it's good. It's really good food. So
who would think a health insurance company would do something like that for its people, for the customers? Like it blows my mind, some of the things that are available now.
Well, and I think I think that's why I'm so pleased. Why I like sitting down with my clients and talking to them about this is that it's changing. It's not a cookie cutter. Oh, you're 65. Here you go. This is what you have, and we're done.
No.
They want, these carriers are sending a message. We want to help take care of you. I think that the biggest obstacle we have right now, as agents of these plans, is education.
Oh yeah, absolutely.
I think the senior market is undereducated on what is out there. Many of these Medicare Advantage plans are $0 premium dollars.
True.
They don't cost anything to enroll.
Right.
You pay when you need the care.
Right.
There are a lot of people that look at that and they say there's something wrong with this. That's too good to be true. And they shy away from it. Right. And I think we have to do a better job, all of us, of sitting down, taking the fear away and really educating the seniors on what they have. There are a lot of seniors out there. And I'm not discounting the MedSup. I want to make a qualifier right here, which is every region is different. Mm-hmm. So I spoke specifically about the 5-county area of southeastern Pennsylvania, which is a very strong Medicare Advantage environment. That is not consistent. You could have areas of the country where the networks are not as strong.
Very true.
And that Medicare supplement is really the best option for the individual. So, it varies, I should say that. But if I'm going to speak specifically to our area, I have clients that have been on a MedSup plan for years, paying a lot of money. And when we sit down and we see that all of the doctors that they use are in a network, a Medicare Advantage network, and they see the cost savings, it's impactful, especially for someone on a very tight budget.
Yeah. I can see how that would be really impactful to the bottom line. It's cash flow. That's cash flow for them.
Well, that's where I'm sure you're having these conversations. And also I know, because you have these conversations with your clients, it's a personal preference. Mm-hmm. I think that's the other thing that my team, we are, goes back to the whole philosophy of Osprey Health. We don't mass market. Mm-hmm. We want to sit down and listen to the needs of our client. We are not swaying an individual one way or the other when it comes to Medicare. There are individuals out there that say, I have no interest in managed care. I don't want to navigate anything. I don't want to deal with bills. I don't want to deal with copays. I don't want to deal with it. Well, then Medicare Advantage is not for you.
Right.
And honestly, for up until recently, most of my clientele was like that because they weren't as familiar with how to navigate managed care.
Right.
As I said earlier in our conversation, we have a generation now coming in who is very well versed on how to navigate it, and they are much more ready to receive these options, these Medicare options, Medicare Advantage options.
Mm-hmm. Mm-hmm. And I like that you say education. We need to educate people who are in that Medicare age better about what's available to them. Because I know when I sit down with my own clients, they don't know, and it's, you know, trying to find the information for themselves. It's deep, piles and piles of information that they have to wade through, and they really need somebody to be there for them, to be their guide and to educate them along the way for what's, you know, what's available to them, and then find out what their needs are, and marry the two, you know, amongst the insurance and the person, you know.
Yeah, and Regina, you know, we've talked about this off camera too. One of my concerns, for people that aren't familiar with our role, our job, the Centers for Medicare and Medicaid mandate that every year, in order to sell or even talk about Medicare Advantage plans, you have to be certified.
Every year.
Every year.
Every year you have to recertify.
And if I may add, you have to pass a certification within 90% or higher, and you only get 3 tries.
Yeah.
So it is not a walk in the park. It is a serious exam. It is difficult. It's difficult for a reason. They want you to make sure you know the ins and outs of Medicare, which is important. But because of that, you do have a percentage of agents in our industry, brokers in our industry, that don't want to do that.
Right. Right.
And
it is very stressful going, when that time comes, I get very stressed out. Oh my gosh, I have to recertify. Oh my gosh, it's very stressful. So a lot of people won't do it. You're right.
And what happens? They don't talk about Medicare Advantage. So when with their clients, those seniors are at a disadvantage because they're only hearing about one particular option. And I don't think that's fair. It is really important that seniors know you have options out there. It breaks my heart when I hear of a senior who thinks that is paying, you know, 70% of her income for the month for a med sup plan, when the alternative is a 0 premium plan for Medicare Advantage, where she's probably most likely in our southeastern Pennsylvania area seeing the same doctors.
Exactly.
And so I do worry that education is so critical. And I really commend you with these videos, getting these out to your audience. The more that individuals can talk about this and learn, and then come to someone like you, someone like me, and ask questions. Who, you know, the very first question a senior should ask is, are you certified to talk about all of the Medicare options available?
Yeah. Yeah.
And if that broker is not, I would caution you, you're only going to get one option.
Yeah, exactly. Exactly. Yeah. So education is key. Education is key. Like how can we educate people? How can we get the word out more, and, you know, offer more education to people who need it.
Absolutely.
Yeah.
And, you know, again, in another 10 years, social media will play a different role than it's played now. You know, we're going to be able, I mean, the whole audience is going to change even more. I give credit to the seniors that are trying to evaluate this themselves. It is a very difficult web to sort through to find out the right answer.
Absolutely. I don't know how they're doing it on their own. Really don't.
No, and you know, we talked about this before, which is, you know, you've got the seniors have 2 terrific options. You can go the Medicare supplemental option. You can go the Medicare Advantage option. It's a personal preference that is based on your income, how you want to navigate the managed care, access to care. But because of those 2 options, I think that the seniors who used to just enroll and not change anything, for 10 years,
Yeah.
15 years, 20 years. Not change. They just kept everything the same. Now they're encouraged to, let me look at my prescription drug plan again. What's happening in my prescription drug? A great example is CVS. CVS bought Aetna. So somebody who has been in a local Part D prescription drug plan might want to consider a silver script plan. CVS's formulary is one of the largest formularies that's being offered within a Medicare right now. They have multiple options to choose from within their formularies, a basic and an enhanced. But they also are providing very competitive rates. So the formularies, for your audience who's not familiar, a formulary differs from one prescription plan to another. So a local Part D prescription drug plan might offer 1,000 drugs. I'm making these numbers up, but 1,000 drugs versus another Part D prescription drug plan that has 60,000 drugs on their formulary. So it's important to evaluate what's going on with the formularies. And if you're on specific medications, your medication could drop from one formulary to another from year to year. So you need to evaluate your formularies every year.
Absolutely.
CVS is offering very aggressive pricing. And one of the things I think is great for seniors, delivery. They can deliver your medications. You can call up, you can ask for a refill, and you get it delivered right to your door. So we're going to start seeing that with Independence Blue Cross and Walgreens and Walmart. But I'm highlighting CVS because they are they're incorporating a lot of different things into their formularies now. I will mention also something new that is for 2021 is CVS has launched these health hubs. Many of us are familiar with a Minute Clinic. Those are the little clinics within CVS stores where you can go get some primary care taken care of. They're not urgent care, but they're more of a primary care for an ear infection or a sore throat. But now CVS is actually expanding that, and they are creating these health hubs. And they are not within CVS pharmacies. They are in and of itself a health unit where you can go in and it replaces a primary care facility. So any primary care needs you have, you can go in and you can access that care with professional nurses, physicians, PAs. One of the things I like for the seniors is they have a whole senior dedicated area of these health hubs to help manage your chronic care, educate you on your options. You have diabetes, they're going to work with you on what you need. And I think that the trend's going to be that you're going to be able to get your diabetic strips, your medications in those health hubs for even a better cost savings than even in the pharmacy. So those health hubs are going to become a real important piece to managing your health care, because it might the primary care office might be 10 minutes closer than your physician's office.
Yeah.
And
it's very exciting. I mean, this kind of like you're giving us a glimpse of the future of healthcare, and it's very exciting and it's accessible, very accessible. And
that's the key.
Accessible.
And if I may add, another element of accessibility, which has it's all been triggered because of COVID, is telemedicine.
True.
And telemedicine is changing the face of healthcare even faster than we thought. Telemedicine's been around for 20 years. It's been so underutilized.
Yeah.
Now, obviously they say that the iPhone was brought to market in 2008. So, I think that the phones definitely have made a difference. I think that our environment as a whole, we are more used to working off our phones, talking FaceTime, so video chatting. So I think all that has played into the success of telemedicine, but COVID definitely has catapulted the access to care for individuals. The different telemedicine options that seniors have, in particularly, are terrific. They can talk on the phone, they can talk FaceTime, they can even communicate via text.
Yeah.
They can be sitting at their kitchen table at 11 o'clock at night and they have an ear infection or they have an ear pain. They can call, they can talk to somebody on the phone, a physician on the phone. The physician can quickly identify what's happening and prescribe medication. And during COVID, this might not be post-COVID, but during COVID, your delivery of your prescription will arrive within 24 hours at no charge.
That's
You talk about
incredible. That's
accessibility,
incredible.
absolutely. So I really, I'm very excited with what we have coming in 2021 for our seniors. I think that, the industry is saying, we care about you, we want to take care of you. And through education, through accessibility and affordability, I think they're going to be successful in doing so.
That's fantastic. This has been a really, really good segment, Meg. Lot of information, a lot of glimpses into what's coming, which is exciting. Can you, if anyone wants to get in touch with you to learn more about how you can help them with Medicare and some of their other healthcare insurance needs, how would they contact you?
Sure. So we are located in Berwyn, Pennsylvania. That is our headquarters. The web address is www.osprey, like the bird, ospreyhealth.com, OSPREY health.com. And my main phone number, you can call me, is 610-727-3822.
Excellent, excellent. And thank you for helping us get everybody to thrive in their health, wealth, and wellness. This is our newest series, Thriving in Your Health and Wealth. And we're so glad to be partnering with you on that.
Likewise, I look forward to asking you the questions next time.
We'll get there. We'll get there. Okay, so thanks everyone. Again, I'm Regina McCann Hess, president of Forge Wealth Management. My website is forgewealth.com, and you can follow me on Facebook, Twitter, and YouTube at Forge Wealth, and on LinkedIn, I'm Regina McCann Hess. Thanks and have a great day.